And I have on the panel three distinguished people. Dr. Samuel Godfrey, based in UNICEF, that's where he works. And he has 23 years of professional experience in the water, sanitation, climate, environment, and energy sector, which includes 17 years with UNICEF and also working as an academic and researcher at institutions like the WEDC. He's the co-author also of the ESAR Climate Crisis and Children Report, which was published last year, and is currently leading the UNICEF Strategic Plan Goal Area 5 output in Eastern and Southern Africa region, which includes water supply, sanitation, disaster risk reduction, children in urban settings, and environmental sustainability. So welcome, Dr. Godfrey. Next, I would like to introduce Ms. Maureen Ambani. Ms. Ambani has over 10 years work experience developing climate services in Africa towards the targeted use of weather and climate information in adaptive decision-making and also in anticipatory action. She enjoys work on developing innovative approaches to apply science into practical use and has worked extensively to facilitate linkages and dialogue between scientists, technical experts in various fields, operational teams and communities, and she currently serves as a regional coordinator for the World Food Programme, supporting countries within the Eastern Africa region to implement focus-based financing approaches and to move from a reactive to a proactive humanitarian system. Her previous affiliations are with the Red Crescent Climate Center, Care International's Adaptation Learning Program for Africa, and the IGAD Climate Prediction and Application Center, ICPAC, and she holds a Master of Science degree in meteorology. So welcome, Madam Ambani. And then we have Mr. Jeffrey Maganya, and Mr. Maganya is responsible for leading the progressive change of the Oxfam portfolio work in social protection and the use of social protection for anticipatory intervention in emergencies. Mr. Maganya has a long experience in social protection, including work on the concept and development of the National Safety Program in Kenya. He has also supported the Somalia state with the conception of the Shock Responsive Social Protection Program. And Jeffrey holds both a master's in sociology and a bachelor's degree in biology from the University of Nairobi. So you're all welcome. And I'll want to begin with my first question, which is directed to Sam Godfrey. We know that UNICEF works with government partners in WASH programs throughout the entire Eastern and Southern Africa region. Can you give us some examples of how the country teams are encouraging partners to integrate climate information into their programs? Over to you.
Thank you so much, Professor Lago. Can you hear me clearly?
Yes, we can.
Super. Thank you so much, and thank you for the question. And really appreciate being invited here as UNICEF for this discussion. And thank you to our colleagues from across Nairobi and beyond who are here, including many of our colleagues from UNICEF country offices who have joined for this session. So as you correctly mentioned, UNICEF works across Eastern Southern Africa, and I have the pleasure of working with 21 countries across the region, where we have operations in water supply, sanitation and hygiene that provide approximately water supply to around 6 million people on an annual basis. And I think what we've seen over the last 5 to 10 years at least is a significant change and shift in the way that we're having to deliver those services because of the impact of the climate crisis. I think all of the previous panelists, and I listened with great interest to the presentations from our colleagues from Oxfam and from the Red Cross particularly. It's very clear that children bear the greatest burden of disease and are of course at greatest risk as a result of climate change, and at greatest risk really of the diseases such as malaria and dengue fever. But yet these children, the continent, of course, have really impacted the climate the least in terms of their level of carbon emissions. Close to 90% of the burden of disease attributable to climate change is borne by children under the age of 5. And of course, they also face the greatest dangers from undernutrition, as our colleague mentioned from his study in Nigeria, and also diarrhea, which of course is closely related to the failure of crops and rainfall. So it's clear really that climate change and the climate crisis is a key driver of disease outbreaks. And the relationship between the increased intensity of rainfall, of flooding and disease outbreaks, as well as its increased prevalence, are really being observed over time. So central to all of our country office operations now is to begin to place very clearly the predictive element of climate change into our operations, into our programs. So as you mentioned, Professor Lago, last year we co-authored and published a report on the climate crisis and children in Africa. And it really looked at the long-term trends as well as the observed sort of warming, which is being associated with both the coastal areas and also the lake areas, particularly in those areas of higher land, which are associated really with global climate processes. And this really, the report really has helped us to understand the transmission rates of different types of diseases which are associated with these climate trends. So let me just give you one very clear example of where we see our country programs and our UNICEF operations beginning to build in climate models into their programming. The 2015-2016 El Nino event, which many of the colleagues on the call were familiar with, was really associated with very severe drought in southern Africa. But of course, it adversely affected also the health, agriculture and water resources and food security of more than 30 million people in the Horn of Africa. And at that time, UNICEF estimated that the incidence of disease in children increased fourfold for diarrhea, threefold for cholera, twofold for malaria, and about 1.5-fold for pneumonia. And it's quite similar to some of the points that were raised earlier by our colleague when he mentioned that 1 degree's increase in temperature has a certain percentage increase in the potential for certain diseases that affect children. So how do we essentially then, as UNICEF, begin to work with our host governments, work with our partners, work with many of the colleagues that are online to make sure that whatever we are then putting in place has a way of responding to that? Well, one example is our collaboration that we have established across a number of countries in East and Southern Africa with the European Union JRC, which many colleagues will know is the Joint Research Centre that is responsible for a number of spatial forms of data and looks at remote sensing information and helps predict certain particular patterns that are associated with weather, but also directly linked with the levels of water availability from different complex hydrogeological areas. And during the El Nino-induced drought, we saw, for example, in Ethiopia, many areas being faced by water-related emergencies. In fact, in that particular drought, around 5.8 million people were affected with water scarcity, in a similar way to, was mentioned by the colleague earlier from Somaliland, where the birkas were drying up on a regular basis due to the erratic nature of the rainfall. So one way that the country operation then integrated the climate models into their programs was then to use satellite imagery and drones. And the drones program to get obviously more detailed data on surface elements. So looking specifically, for example, at the topography of particular areas, the slope of particular areas. And then using radar technology, which was linked with the satellite imagery from the JRC, we were able to identify extremely deep aquifers in those areas. And these are really the areas to the east of Ethiopia, which border also with northern Somalia. And also, as you know, Professor Lago, are also commonly used and beginning to be used more expansively in northern Kenya. And these types of techniques that UNICEF has been pioneering over the last decade have really helped to identify deep groundwater, which can then not only be mapped, but also developed and then managed in those areas to provide water to areas which are affected by these increased disease patterns, which are happening as a result of the climate shocks. So it's a very, very interesting and well thought through solution, which has also then been expanded to Southern Africa and been very successfully applied also in the southern area of Madagascar, for example, as a way of integrating the areas of climate modeling into the country program operations of UNICEF. So I'll stop there and I'll look forward to any further questions related to this. Thank you.
Thank you very much for that very nicely elaborated answer. That very nice and elaborate answer to the question. And I'm happy that you have been able to unpack a little bit of what is contained in that report on the climate crisis and children. And I'm also very happy to see that you have actually incorporated, sophisticated methods to help in your planning for the future because of the challenge of climate change. And this is one of the areas where we are looking to, build capacity and to get more agencies, proficient in the use of these, or to have a kind of a shared, skilled base by which all this kind of information and secondary derivatives of data can be availed. And in particular, also, I think, is also the importance of having these nice, satellite data as well as drone data, because once this kind of data is acquired, it can be shared. So one doesn't have to expend, money again, carrying out similar exercises in an area which has already been surveyed. So thank you very much. If the participants have any questions, please put them in the Q&A. We'll be keeping an eye on that, and we may table them to the panelists. But I want to go over to Maureen Ambani. We have had talks about the focus-based financing, and I know that you have worked on this in the past. Are you adapting the approach to your new work in the WFP? And is there an opportunity for you to work with UNICEF and other WASH actors in order to expand this to the WASH sector?
Thank you very much, Professor Olago, and everybody for joining these conversations. Quite useful questions and presentations coming through. Okay, so in terms of our work in WFP, in Eastern Africa region, particularly, we are focusing on working on focus-based financing for drought because the slow onset climate hazard offers us an opportunity to be able to layer different kinds of risk reduction actions from months up to weeks in advance of a forecasted rainfall season, and especially before adverse impacts occur. And this is especially relevant for the Eastern Africa region, where we know 2 consecutive failed rainfall seasons often results in severe adverse humanitarian impacts. And so WFP is working with national meteorological and hydrological services, government national disaster management agencies, and key sectors, including health, WASH, agriculture, and various other key climate sensitive sectors, as well as various humanitarian organizations, research and scientific organizations to either set up focus-based financing systems in the Eastern Africa region countries, or to enhance existing systems so that we are better able to forecast drought before it occurs, and especially to be able to activate anticipatory actions based on these forecasts. So the idea is for us to move from traditional humanitarian response, where we react when millions of people are in urgent need of humanitarian assistance, and often there isn't enough money to help meet the humanitarian assistance needs that there are, to a more anticipatory humanitarian action way of doing, such that we're not caught up in repetitive crises of responding after the fact. And what we are doing is working with various stakeholders to, first of all, predefine the drought impacts and the risk levels that are of concern to us and to the particular context, including figuring out who's most vulnerable to drought, what are the numbers of people who will be potentially affected, using various sets of risk data that are available within WFP, within government, within other humanitarian organizations. And then we are also working with the National Hydrological and Meteorological Services, together with key international institutions like the UK Met Office, the International Research Institute for Climate and Society at Columbia University, to especially be able to predefine what are these forecasts that we are going to use to trigger anticipatory action, and especially factoring in the uncertainty we know is in forecast, especially in this particular region. And then based on this, we are also predefining anticipatory actions to either prevent the potential impacts or to mitigate them as much as possible. And quite importantly, we are working to pre-allocate and also pre-mobilize where that's relevant, finance for us to be able to implement anticipatory actions before a drought is forecasted to occur. So in terms of working with UNICEF and other WASH actors, yes, indeed, that is quite critical, and that is already happening in the region in countries such as Somalia and Ethiopia. So for example, under the OCHA SAF Anticipatory Action Pilot in Somalia, WFP together with UNICEF, WHO, and other UN agencies are currently implementing a commonly agreed anticipatory action framework with a pre-allocated finance of up to 20 million US dollars from OCHA. And the idea behind this common anticipatory action framework is that we are defining focus-based actions for food security, such as cash distributions implemented by WFP to help households to access nutritious food before harvests potentially fail. And of course, when people get food, they also need water. So of course, we are working with organizations such as UNICEF to be able to implement WASH-related focus-based anticipatory action, such as provision of clean water to especially reduce potential communicable disease outbreaks that we know often results from water scarcity when there's a drought. So all of these are aimed to be done before drought impacts are actually manifested and based on a focus that we have already predefined. So the idea is that when we are developing focus-based financing systems for drought in the region, there's a whole range of drought impacts that are considered that often cut across different sectors, including WASH. So it is quite important to work with the relevant government sectors, institutions, and organizations involved across the sectors for us to be able to deliver focus-based anticipatory action and therefore address the potential impacts of drought as holistically as possible. And so towards this, there's a lot of collaborative efforts that are ongoing in Eastern Africa to co-develop these focus-based financing systems and especially to deliver joint actions. And part of what is happening is that technical working groups for focus-based financing have been set up in the countries in Eastern Africa region, involving various stakeholders. And what I would really encourage actors in WASH is to be part of these technical working groups so that we can better co-develop and jointly develop focus-based anticipatory actions in Eastern Africa region.
Thank you very much, Ms. Ambani. It's quite, I think it's very good to see that there's a lot more effort going into preparedness and, early action to mitigate the impacts of potential climate impacts as well as related disease outbreaks that may occur. And you've also mentioned a lot of this, interaction with other agencies and groups. But just something for us to ponder right now. I don't want to ask you for a response at the moment, but just to think, how can we kind of get, what's the model? Because we all say that we're working with A, B, C, D, but is there a structured model that people can really get into, which could serve as a very nice kind of networking base for people within the region? But maybe just think about that as I pan over to Geoffrey Maganya. And Geoffrey, my question to you then is, you have been working on shock responsive social protection to cover extra needs before and during a shock in your work with Oxfam. So building on what Maureen has been talking about, how can climate information be used to trigger support at household level, and how can this specifically focus on preventing disease outbreaks in WASH?
Thank you very much. I think that I need to start by saying that I guess one of the things that's not been talked about, and I'm probably going to talk about it a lot, is if you will, quick onset epidemics. We've talked a lot about malaria. We've talked a lot about other waterborne and water-based diseases. However, as a development player, Oxfam is not very strongly related to curative and strictly public health interventions, and it's more humanitarian and development. So first, when you have this kind of shocks, they come, in a sense, there are three sets of shocks that come. So the first one is a shock that comes as a result of the epidemic. So like COVID comes in and it's manifested by illness, hospitalizations, and sometimes death. And the sort of buzzword that typifies this shock is flattening the curve. And in this sector, in this period, the biggest player, a health service providers, and emergency and humanitarian sector players. Well, the second shock is more a shock that's an indirect result of the epidemic. And so it is a socioeconomic shock. And the main buzzword you hear a lot around this shock is job losses. The biggest players around here, humanitarian and development players. So there's this continuum. And then the final shock that comes in is more indirect shocks, which results from the responses to the epidemic. And the buzzwords you hear a lot are mental health issues, increased gender-based violence. And this is the space where mainly developmental actors have a very big role. And so, like I said, I think that the type of epidemic that we face determines the kind of action and the kind of players who are called in. So if you have a quick onset new epidemic, novel epidemic like COVID-19, or maybe a mutant of SARS or Ebola, you have mainly medical sector players and humanitarian players coming on because it's quick onset. It's a bit like any other emergency that you face. You may also have quick onset epidemics, such as cholera, which are old, and we probably turn to the shelves and pull out the sort of tactics that we've used in the past and go on very clearly to do it. But then you also have slow onset epidemics such as HIV, probably malaria and typhoid, and other waterborne and water-based diseases that it's mainly health and developmental players that play into that. So in terms of responses so far, before I go to preparedness, there's been, if we have a zoonotic epidemic like COVID, that's probably novel and spreads very quickly, the interventions will include public health and hygiene interventions. such as social distancing, lockdown, vaccinations, including curative medical services. Oxfam does a lot of work in this public hygiene space in response to cholera and other acute diarrheal diseases. And I think that the Somalia Oxfam team gave examples of what we actually do on the ground. We also have, after that initial shock, we have the second shock, which is the shock that is caused by that initial shock, which is mainly social and economic in nature. We have social protection measures that can come in, such as cash transfers, tax policies. This deals with the social and economic consequences of the epidemics. Now, Oxfam in Kenya has had a robust response targeting probably 80,000 people, and I think it's done in collaboration with Red Cross in informal settlement Kenya with cash transfer responses to the social and economic impact of COVID-19. The other response that we have is essentially community preparedness and response to any kind of shock that comes. Poverty reduces the capacity of people to respond to any kind of shock, including health shock. So any work that we do around communities to strengthen their capacities actually prepares them to be able to deal with medical and socioeconomic shock. You have a lot of reciprocal altruism, which you've seen. People do things because other people did things for them earlier. We have the use of social capital as a means of community response to health and socioeconomic shocks. And Oxfam works with communities in strengthening the resilience of community. This reinforces community social capital. The other intervention that may be used, that should be used, and we are at the early stages of doing it, is
Jeff, if you can summarize it in 20 seconds for us, please.
In 20 seconds. Okay, so in 20 seconds, in terms of preparedness, we need to expand contributory social insurance for those in employment. Secondly, we need to create a social registry that allows for quick social protection response in relation to non-contributory social assistance. We need to prepare and enforce labor market interventions such as site breaks and surveillance payments. We need to continue with global discussions on vaccine justice currently being undertaken by Oxford. And finally, we need to develop a multifaceted and multidisciplinary climate change interventions. Oxfam is currently developing a regional response to this climate crisis. Thank you very much.
There's a question here that I think best goes to Dr. Sam Godfrey, which is from Brian Reed, which says that the climate crisis is finally being recognized, but how can we allocate WASH or health resources to a future issue when we still have people without any basic services? Do we reduce progress on the SDGs today to divert resources to climate change related issues? The next question is from Alfred Opere and is directed to Maureen. How does the forecast skills affect the needs assessment and funding priorities? And is there a feedback mechanism?
Thanks so much, Professor Lago. I'll be very quick. In 2019, UNICEF conducted a study on the financing gap for the SDG across the 21 countries of East and Southern Africa. As the sort of custodian also of the JMP data along with WHO. And that study showed that there's at the moment a requirement of around 14.7 billion US dollars annually that's going to be required between 2020 and 2030 to be able to get anywhere near some of the SDG targets. And in fact, the SDG review that's currently being undertaken by UNICEF for the region is actually showing that the numbers may well have increased. So I think in answer to the question from Brian Reed, I think it's important to perhaps refer to the life cycle costs of different water supply interventions. Indeed, there's no doubt that if you go for a low-cost basic water system, you potentially can cover a larger population and a larger number of people. But I think increasingly what we're seeing is that climate is affecting the sustainability of those lower cost technologies. I mean, not least the fact that we're seeing a huge drawdown on groundwater levels, which of course are making some of the more lower cost technologies that had been promoted previously more complex. So the study that I put on in the chat box is a study that was undertaken over a 20-year period over in Ethiopia, which basically compared, UNICEF compared the unit costs of a basic water system, which functions essentially only for 6 months of the year, because for the remaining 6 months of the year, those communities are affected by drought and are therefore receiving water through water tankering or water trucking, as well as water treatment from various different NGOs. And it compares the cost of that with the cost of constructing a climate resilient water system, which would involve, of course, development of a well field, piped water transmission system, which would enable us to have adequate water for the social distancing that was mentioned, for the hand washing that's required for COVID, and have actual running water at certain locations. And it found that the unit costs for the basic water systems themselves were over that period around $2,200 per capita, compared to 65 US per capita for the pipe water systems. So I think the numbers speak for themselves, that if we are going to invest to get to the SDGs, we need to invest in climate resilient water systems. And this is precisely why UNICEF also has prioritized climate resilient water and sanitation as one of our key 3 major shifts that we're making as an organization, not only across this region, but across the world. Thanks so much. Thank you.
Jeffrey, you can probably take the one, I think you're more familiar maybe with Kenya, so you can take the question by John Kinyoki on how can we partner with local players in dissemination of these valuable findings and in WASH intervention.
Yes, very quickly. So partnership with local players. So I think that non-state actor networks and government leaderships in sectors that deal with social protection and emergency is really the answer. And in terms of improving predictions, not really as social protection is not really as much as prediction as the fact that there's going to be shocks. So shock responsive safety net registers that can be kicked up in case of any shock during anybody's life cycle is really the key. Thank you very much, Parvin.
The next question is from Alfredo Pere and is directed to Maureen. How does the forecast skills affect the needs assessment and funding priorities? And is there a feedback mechanism?
Okay, thank you, Professor Lago, and thank you also, Professor Perry, for that question. So it's about how focus skill is affecting needs and funding priorities. Indeed, it is a big concern. Part of the paralysis for actors to take action on our forecast is because they don't understand enough about the probabilistic nature of the forecast, and they don't know enough about the accuracy of the forecast. So part of what we are doing in the forecast-based financing approach is to work together with the meteorological services for them to be able to clearly explain the probabilistic nature of the forecast, and quite importantly, to develop information about how skillful, or rather what's the level of accuracy of the forecast that they are developing. And based on this information, we are working together with stakeholders to start to understand, okay, if a forecast can only be like 70% correct, what types of actions can you take based on the level of skill in that particular forecast? Are you happy to, let's say, take an action around like cash distribution for people to be able to, take action on their WASH needs or food security needs? Or do you think that is a very costly kind of action that you want to wait until there's more certainty in the forecast for you to be able to implement that action? And increasingly, we are finding that once people start to understand this kind of information, that this is as good as it can get, considering the level of science we currently have, considering the capabilities of the national meteorological and hydrological services in the region, people are starting to get comfortable to take action, even if the action will be in vain in the end, that maybe they thought a drought would happen, maybe it doesn't happen, or it's not as bad as they thought. But then in the end, there's thinking around, can we start to implement actions that are low regret, in the sense of, even if we distribute cash, we are targeting like the most vulnerable people who would have needed the cash anyway, even though they wouldn't necessarily implement it to mitigate the kind of drought, maybe actions in WASH that we had expected them to do. So really moving forward, the idea is for us to have joint collaboration and discussions on these kinds of issues and to be able to plan on this together. Thank you.
Thank you so much to all the panelists for the great insights you have given us with regards to the work that your respective organizations are doing. And as we move to winding down, I was just reflecting on the objectives that we had at the beginning of this webinar, from yesterday to today, we really wanted to look at how we share experiences and learn, as practitioners in the health, WASH, and climate change space. I feel we have achieved that objective. We've got very great information that has been shared, research that is being worked, pilots that are being undertaken, innovations that are being trialed in different spaces. So definitely a lot of sharing of experiencing. We've also talked about tools, that could be adopted in different places, and the challenge is really on us with regards to what we could do, especially as we look at developing a way forward for contributions around how we can improve WASH work, WASH programming, as we look at forecasting around diseases and outbreak preparedness. Now, what I'm going to propose is that we continue these deliberations. As a team, we are hoping that we can have other platforms where we have these discussions, but please, there is a website at the moment which you had used to register. You'll see it in the slide that has been shared. It's www.whatworks.co.ke, climate workshop. We'd like to take forward some of these deliberations, some of the ideas shared. The biggest things I feel as we look at what could be done in our next steps are the possibility of taking to scale some of the ideas, the possibility of adopting or replicating the ideas that have come up, but also looking for resources to support the work that is being done and the ideas that are already being extrapolated. I feel we have achieved our objectives, and I really would like to appreciate all those who have participated in this webinar yesterday and today, and we look forward very much to collaboration as we go forward. So I'd like to declare this event officially over. Thank you so much to all the organizers from Oxfam, MSF, Center for Humanitarian Change, University of Nairobi, Think Place. Thank you so much for all the participants. We've had great participation, and we do hope to carry these conversations forward. Thank you very much, everyone.